What up, guys? It's your boy B, man. I don't got much today, man. I just want to check out this article here on CNN Health. The pandemic may have created a nation of problem drinkers, and many are women. Saturday, January 22nd, 2022. For many people, social drinking is a celebrated pastime. At least it was in the good old days, before we began living COVID's nightmare version of Bill Murray's Groundhog Day. During the pandemic's repetitive grind, enjoying an occasional glass of wine with the girls has been replaced by Zoom, wine hour, or worse, drinking in solitary confinement. The data we have shows that drinking is definitely up since the start of the pandemic, around a 14% increase in the number of drinking days per month, said Dr. Sarah Wakeman, medical director of the Substance Use Disorders Initiative at Massachusetts General Hospital. For women, the numbers are even higher, Wakeman said. There's actually been a 41% increase in heavy drinking days among women since the onset of the pandemic. Why would women be turning to drink more than men? Studies have shown the complexities of balancing home, work, and caregiving responsibilities during the pandemic have disappropriately fallen on women, said Dr. Lena Middle, chief of the Women's Mental Health Division in the Department of Psychiatry at Brigham and Women's Hospital in Boston. There's also a lot of marketing of new alcohol products targeting women and especially moms, said Middle, at a time when everyone is watching a lot more TV. Add to that the pre-pandemic mom wine culture that normalized and in some ways even glorified alcohol, and the line between social drinking and at-risk drinking can quickly become blurry, she said. The pandemic has a tale of lost boundaries. The pandemic has also blurred the boundary between home and work for many women. Middall tells the story of one of her female patients who walked home from work in pre-pandemic days. She would have a 30 to 45-minute walk that served as exercise. It served as alone time. It served as stress relief. Middall said she could transition from work to home responsibilities, and in the end, it gave her a buffer. But since the pandemic, those lines have blurred. In an effort to create sense of space for herself and for her mother who lived with her, Middall's patient began to turn to alcohol instead. After her kids went to bed, she would have a glass of wine and two with her mother. Sometimes it would be tea, but often it would be wine, and it quickly became more than they had been drinking in the past. Middall said, and I think this is a really common story. Coping is even harder for those who already struggle with alcohol and substance abuse before the pandemic began. Experts stress it's likely the whole society is on fire, including those who have known mental health and substance use disorders. Middall said. Health dangers of drinking. A higher level of drinking in women is worrisome, Wakeman said, because of the link between alcohol and the risk of female breast cancer. And any amount of drinking does increase your risk of breast cancer, and this is a unique risk among women. There really is no safe level of alcohol consumption when it comes to breast cancer. There are many consequences from drinking too much from both women and men. Accidents and injuries are associated with drinking even moderate amounts. Domestic violence is often fueled by alcohol, as is child abuse. It also plays a role in myriad health conditions. You could have health related consequences from alcohol use outside of addiction, Wakeman said, like high blood pressure, acid reflux, liver disease, and liver injury, which is sometimes we're seeing a huge increase in, particularly among young people and women, in a way that we've never seen before, not to mention the toll on mental health, including depression, anxiety, and more. A number of studies have shown that increased alcohol use in the pandemic has been associated with increased mental health symptoms even in people who didn't have prior diagnosis or prior mental health needs. Middall said, "Have you crossed the line, man or woman? How do you know if your has? How do you know if your use of alcohol has crossed the line to the dark side? One tell-all sign is when drinking is beginning to interfere with your ability to go through your daily life. Experts say alcohol use. See how they switch it over from now. The article was based on women, but now they want to put both men and women. But alcohol use disorder is defined as a compulsive use alcohol despite having negative consequences from your use, such as the impact on your relationships, your ability to function in your job, or whatever roles you have in your community. Wakeman said. Another sign you continue drinking despite the negative impact on your physical and mental health, and it doesn't have to be calling in sick or working with a hangover. It can also be not feeling well or having a hard time getting up in the morning, mid offset. And don't forget relationships. Are you having more disagreements? Are people in your life expressing concern or noting that you're different, hiding your drinking or lying about it? These two are concerning behaviors. Here's a red flag. You're pouring drinks without realizing it. Current American Health Association guidelines call for no more than two standard drinks a day for men and one for women or anyone 65 or older. But just what is a standard drink? It's 12 ounces of regular beer, 4 ounces of regular wine, or 1.5 ounces of liquor if you're drinking spirits like instead. Yet people may be pouring a huge goblet of wine and not realizing that it's actually 2 to 3 servings of wine and not just one. We know that millions of Americans drink above those levels, even in pre-pandemic times. She's added in 2019, some 66 million Americans had episodes where they were drinking higher than those recommended limits. If you or a loved one appears to be struggling with alcohol, don't hesitate to reach out for help. Experts stress there are many different support groups that can assist, such as 12-step programs or individual therapy. If you find yourself with no true red flag but want to reduce consumption for overall wellness, I'll suggest doing so with compassion. We're all experiencing amounts of stress and trauma. Everybody has limits, and we're all being pushed beyond our limits right now. Self compassion is really important in all of this. I worry about people feeling like they've done something wrong if they're drinking more than good for them. It's not a moral falling. If you're seeing signs that things aren't going as well as they could, give yourself some grace and focus on self care instead of drinking. Funny how they start the article off about women, but then all of a sudden they twist it to both parties. You know what I'm saying? But leave your comments in the leave your comments down below, guys, as far as what you think, man.